Hey y'all, today our NCLEX question of the day says, the nurse is teaching a client who is scheduled to receive chemotherapy. Which of the following statements by the client would require follow-up? So option 1 says chemotherapy targets cancer cells in my body that are currently dividing. This is going to be an incorrect option because it is a true statement. We know cancer is caused by really rapidly dividing cells, so we want to stop that with chemotherapy. Option 2 says my urine may contain a trace amount of chemotherapy for several days. This is going to be an incorrect option because it is a true statement. For about 48 hours after receiving chemotherapy, we want to be very careful handling bodily fluids of someone that has received chemo. Option 3 says the lining of my gastrointestinal tract may be affected by chemotherapy. This is going to be an incorrect option as well because it's a true statement. We know chemotherapy can cause like nausea and vomiting, mucositis, diarrhea, or constipation. It's just can really harm some of our like normal mucosa. And then option 4 says chemotherapy will be administered through a small peripheral venous access device inserted in my hand. This is an incorrect option. We know that chemotherapy is kind of caustic to the vein. It is a vesicant. It can cause tissue breakdown there. So we want to give chemotherapy through a big vein, usually through a central venous access device or an implanted port to reduce that risk to tissue injury.